Okay, in this next chapter we're going to talk about splinting. And this is going to be chapter 16. If you're following along in your book. So let's just talk about what a splint is, in case you've never seen one. What it's going to do is stabilize a limb, especially if the limb has a fracture or dislocation. So a splint, anything that's a solid object for like a rigid splint, so it can be improvised if you need it to be. Actually, there's different types of splints, and I'll get to those in just a second. It can be improvised, so it could be two fairly straight sticks. You know, if you were out in the wilderness, you could roll up newspaper, anything, especially if you're trying to make a rigid splint. Let's talk about the different types. So a rigid splint would be something that's going to be solid. It's not going to be flexible, so it's not flexible. So you want something that will support the limb. And I've got some videos on the Blackboard course that show students splinting or even doing a rigid splint for a forearm. So not only do you have a rigid splint, but you have an anatomic. And so that's using a non-injured limb. So use another non-injured limb. So let's say we've got our fingers here. So this finger is broken. I can tie this finger off to the other one or tape it up. I mean, it can be just that simple. Or we could have two legs here, and we could put some padding in the middle here, and then tie these legs together with some sort of binder, some sort of swath, you know, just kind of tie them together. So that's a way to do an anatomic splint. An anatomic splint can even be a sling. So if you put somebody's arm in a sling, so we got the sling here around the arm, so it goes up over their neck and around their back. So here's their head. You can tie off with a swath and tie their arm inside the sling to their body. That would be another anatomic splint. So you're taking a soft splint and an anatomic splint together. And so the next one that I just mentioned is a soft splint. This is like a sling. Or if you took a blanket and rolled it up to kind of encase an ankle to protect it, that would be a soft splint. So it's going to be flexible. It's going to kind of mold around the object that it's supporting. And there's different uses. So here are some basic guidelines. It also depends on the type of splint that you're using, but here's some general principles that you should follow. If there's an open wound, you want to cover it. So cover open wounds. Preferably with like a sterile dressing if it's present. But if you're out in the wilderness, you may not have access to it. Again, with the acronyms, we've got CSM, so circulation, sensation, and movement. You want to check those. We want rule of thirds. So you want to check the limb and try to determine where the injury is. And so we talked about that before, using the rule of thirds to determine where the injury is. So you break it up into 3 parts. And if it's in the upper or lower third, then we're going to assume that there's some sort of joint injury. We want to support the injured site, the injury site. Especially if it's in like a long limb, like a forearm or a leg, you definitely want to support it as much as possible. And so that the limb doesn't flop around when you're moving somebody, because it can cause further injury. So when possible, you want to splint both sides, and this goes along with what I was just saying. Splinting on both sides just is more support, and you want to try to tie those two together, but not too tight, because if you make it too tight, you can cut off circulations. So you want to apply that firmly. I'll just write that right here. So 6, apply your splints firmly, but right after that, check for circulation, sensation, and movement again. And then also rest, ice, compress, elevate if needed. You want to seek medical attention if there's an open fracture. Really, if there's any type of fracture. I know your book says if there's an open fracture, but if there's any type of fracture, you want to seek medical attention. But definitely if there's an open one. Dislocation. If there's some sort of joint injury that has a lot of swelling. So we're not just talking about a little bit. If it swells up, moderate swelling, extreme swelling, you want to seek medical attention to get control of that and see if there's any other type of injury. If there's deformity, often that's going to be some sort of fracture. So you want to seek medical attention for deformity. And if the victim can't walk or bear weight on a limb, then you definitely want to seek medical attention. So let's talk a little bit about a sling. That's a soft splint. Those are the ones that I was referring to earlier where you could make it an anatomic splint. So let's say here's a person, they're kind of cradling their arm. Now I've got some videos on this, on how to apply a sling. So the sling itself, just draw the rest of their body there. Sling itself, you're going to drape it, you're going to bring it underneath this arm, so that one part drapes over the shoulder here. It's going to wrap around the arm here and then tie together behind, so that the arm is kind of cradled inside that sling. So let's say this is the sling here and it's tied in a knot, and then here's the other part of the sling that goes around. It ties behind their neck so that their neck itself cradles it. I know that's not the best picture. And then the arm is draped inside there. And I'll have some videos on how to utilize a sling. That's a soft splint that can be made into an anatomical splint by just putting a swath across there, which is essentially a binder that binds it to the body. So I hope that explained some of the basics behind splinting and the different types of splints that you can use. It's a pretty simple chapter, but they do give you a lot of skills, and it would be good to go through and practice a lot of the skills that are in the book. I'll also have some other videos up that shows you how to apply different variations of splints, be it anatomical, rigid, soft splints, and how they're commonly used. So I hope you enjoyed this video. I'll see you in the next one.